Hello, my name is Kat, and today I'll be talking about the functions of the glossopharyngeal nerve, also known as cranial nerve number 9. So it's a mixed nerve with bilateral innervation. It originates in the medulla oblongata. It exits the skull by the jugular foramen and is later terminated at the pharynx. So this nerve is very closely associated with cranial nerve number 10, the vagus nerve, because of their close proximity to each other and therefore interconnectedness. So first I'll start talking about some of the nuclei that are associated with the glossopharyngeal nerve. So first there's the nucleus ambiguus, which is a motor nuclei that provides bilateral innervation and is located in the medulla. Second is the nucleus solitarius, which is a sensory nucleus, and that is located in the lower pons and the medulla. Then we have the spinal trigeminal nucleus, which is also a sensory nucleus, and that is located in the pons. And lastly, we have a parasympathetic nucleus called the salivatory nucleus, which also is located in the pons. So this nerve has four important fibers that make it up: the branchial motor fiber, the visceral motor fibers, the visceral sensory fibers, and the general sensory fibers. So the branchial motor fibers are important in sending motor innervation to the stylopharyngeus muscle. This muscle is very important in elevating the larynx and lifting and widening the pharynx. This is very crucial in swallowing. When the larynx is elevated, the epiglottis is closed onto the glottis, and that prevents any aspiration. So the next fibers are the visceral motor fibers. These provide motor innervation to the parotid glands, which are important in creating saliva. This is also important for swallowing because it helps with collecting the bolus, lubricating the bolus, and then it helps make the swallow and initiate the swallow much easier. It also is important in keeping the oral cavity very hydrated and healthy. The next fibers are visceral sensory fibers. These send sensory signals up to the brain from the carotid sinuses and the carotid body. So these fibers are important for maintaining the homeostasis of the blood, essentially making sure the blood pressure is right and making sure there is a balance between oxygen and carbon dioxide. And lastly, we have the general sensory fibers. These provide sensation to the upper pharynx, the external and middle ear, and that includes the eustachian tube. So it provides sensory information about how much pressure is in the eustachian tube, whether there is any infection and feeling that doesn't feel right in there. And these fibers also provide the sensation of taste to the posterior 1/3 of the tongue, as well as just the sensation aspect. I should note that there are some important branches of the glossopharyngeal nerve that are significant to speech-language pathologists. The first branch is the tympanic nerve. This branch provides sensory information to the middle ear and the eustachian tube that I mentioned previously. Then we have the stylopharyngeus nerve that branches out and innervates the stylopharyngeus muscle. Then we have the pharyngeal branches, which actually branch off of the nerve and join with the branches of the vagus nerve, and they provide motor innervation to the muscles of the pharynx. Lastly, the lingual branches branch out to innervate the taste buds and provide sensation to the posterior part of the tongue. So now we're going to begin the assessment of the glossopharyngeal nerve. The glossopharyngeal nerve and the vagus nerve are often assessed together, so the assessment looks very similar. Hi, can you please state your name and date of birth for me, please?
Jennifer Badesha, 10/10/98.
Thank you. And how are you feeling today?
Great.
Awesome. So when I'm communicating with the client, I'm listening for any hoarseness or trouble speaking, and I hear none, so I can rule out dysphonia and dysarthria. Now I'm going to ask for you to take a sip of this and swallow. Any trouble?
No.
Great. There's no trouble swallowing, so I can rule out dysphagia, and I know that her elevation of the larynx is working properly. So now we're going to look in the back of your throat with this tongue compressor, and I'm going to ask you to say ah. Say it again. All right, very good. So I see that her uvula is constricting and moving up centrally and not deviating from any side. Now we're going to test your gag reflex, and I'm going to hit the back of your throat in 2 places, okay? 1 and 2. All right, great. So her gag reflex seems to be working because the 2 areas that I hit are constricting on both sides. So now I'm going to test your sensation and taste on the posterior part of your tongue, okay? I'm gonna put a Q-tip on that area, and I'm gonna ask if you taste sour, bitter, or sweet. Okay, open up. What was that taste?
Sour.
Yes, very good. So her taste sensation seems to be working, and everything seems to be intact. Thank you for the
Thank you.
The glossopharyngeal nerve is significant to speech-language pathology since damage to this nerve can cause a variety of speech and/or swallowing disorders and dysfunctions. Cranial nerve 9 damage can cause dysphagia, which can result in difficulty swallowing, and as well as choking and aspiration. This can lead to malnutrition, dehydration, as well as pneumonia. Glossopharyngeal nerve damage can also reduce the sensation in the pharynx, which can lead to the absence of the gag reflex. The gag reflex is very important for the prevention of choking, which is why I tested it. It's afferent sensory component during the assessment. Another thing to note is that this damage to this nerve can affect phonation, since this nerve plays a role in the shaping of the pharynx when producing certain phonemes. Damage to this nerve can also affect the parotid glands secretion of saliva, and this can affect taste, mastication, and eventually it may cause dental health problems. And lastly, damage to this nerve can affect the taste sensation in the posterior 1/3 of the tongue, which can affect the patient's lifestyle. Thank you for listening about the glossopharyngeal nerve.